Assalamu alaikum everyone, I hope all of you are doing well. In this video I am going to talk about hypertensive emergency and hypertensive urgency. So first is the hypertensive emergency. Hypertensive emergency is defined as the systolic BP when equal to 180 or greater than 180 and the diastolic BP when equal to 120 or greater than 120 plus there is in-organ damage. So this condition is called a hypertensive emergency. One, the systolic BP must be greater than 180 and the diastolic BP must be equal to 120 or greater than 120 plus there will be in-organ damage. So this condition they called as hypertensive emergency. In this definition I mentioned the in-organs. So what are the in-organs? Here you can see I have written here the eyes, CNS, heart, lungs and kidney. These are called the in-organs. So I have mentioned here that plus in-organ damage. So there should be in-organ damage in order to define the hypertensive emergency. So in the eyes there will be papilloedema. So this is the eyes is a in-organ and the damages papilloedema. In the CNS, the mental status become changed. There may be intracranial hemorrhage. This is the damage in the CNS which is occur as a result of increased blood pressure. The other is the heart, which is the third in-organ. In the heart, there may be unstable injury due to elevated blood pressure, and there may be MI, and there may be heart failure with pulmonary edema. So in the lungs, there will be pulmonary edema. In the kidney, there will be renal failure or there will be oliguria. So these are the in-organ and these are the damage in the in-organ. So systolic BP when equal to 180 or greater than 180 and diastolic BP when equal to 120 or greater than 120 plus the in-organ damage. This condition is called a hypertensive emergency. Now there is another term which is the hypertensive urgency. So hypertensive emergency, medical emergency which should be treated immediately, and this is the hypertensive urgency. And the hypertensive urgency and hypertensive emergency are the same thing, but the in-organs are not damaged in the hypertensive urgency. Systolic BP when equal to 180 or greater than 180 and diastolic BP when equal to 120 or greater than 120 without in-organ damage. This condition is called a hypertensive urgency. So in the hypertensive urgency and emergency, the blood pressure elevation is the same, but the in-organ damage are not there in the hypertensive urgency. Now how to treat the hypertensive urgency? It should be treated within 24 hours by the per oral antihypertensive medications. So the per oral antihypertensive medication are the captopril, which is the ACE inhibitor, and clonidine, which is the alpha 2 agonist, and the labetalol, which is the beta block. So these are oral antihypertensive medication which is used to treat the hypertensive urgency. Now what are the causes of the hypertensive emergency and hypertensive urgency? The causes are the non-compliance with antihypertensive medication. The patient is not using the antihypertensive medication properly. So this is the one cause. The other is the Cushing syndrome. In the Cushing syndrome, the cortisol level is elevated and there is a minor activity of the cortisol just like the mineralocorticoid. So it absorbs the sodium and absorbs the water into the vessel, so it can increase the blood pressure. The other are drugs. Drugs include the stimulant like the cocaine, LSD and methamphetamines can also elevate the blood pressure. The other is hyperaldosteronism, in which the aldosterone level is increased, which will absorb the sodium and absorb the water, so as a result the blood pressure will be elevated. There is eclampsia, also a obstetric condition in which the BP is elevated. The other is vasculitis. This can also increase the BP, and the peuchromocytoma, which is a malignant condition in which the epinephrine and norepinephrine level are elevated. So it then causes the blood pressure to elevate. Now what are the clinical features of hypertensive emergency and hypertensive urgency? There will be severe headache and there will be visual disturbances and there will be altered mental status. So these are the three clinical features of the hypertensive emergency and hypertensive urgency. So how to treat the hypertensive emergency? As I have already talked, that hypertensive urgency should be treated by oral antihypertensive medication, while the hypertensive emergency should be treated by IV antihypertensive medication. So the IV antihypertensive medication are the labetalol, esmolol, and nicardipine, which is the IV calcium channel blocker, and the nitroglycerin. These are the IV antihypertensive drug. There is a condition here you can see which is called a PRESS, is abbreviated as posterior reversible encephalopathy syndrome. Posterior reversible encephalopathy syndrome. This is a condition which is occur in the hypertensive emergency. That is a CNS damage. In this condition, the autoregulatory mechanism of the cerebral vessel become impaired and there is endothelial dysfunction. So the cerebral vessel then not able to autoregulate. Result, the blood vessel become dilated and there will be extravasation of fluid into the cerebrum. So the patient will feel the headache and the mental status will be changes, and there will be visual changes and there will be seizure. So this is the clinical feature of the PRESS. Now what is the radiologic finding of the PRESS? As I have already talked, there is the extravasation of fluid from the cerebral vessel into the brain matter. So on the MRI, I will find the posterior cerebral white matter edema. So this was all about an hypertensive emergency and urgency. For more videos, subscribe, like and share. So thanks for watching the video.